welcoming the two surgeons here in Greenville from the ECU Brody School of Medicine that are doing a new procedure at Vidant Medical Center to cure acid reflux. Happy to welcome to our Vidant Spotlight this morning Dr. Carlos Anciano and Dr. James Spiker. Did I get the names right?
Yes,
I've been practicing. How are you guys? Thank you very much for being here.
Good, thank you. Thanks for having us.
This has made a real splash here. It's been talked about for a while, but this is the first time any surgery has been offered in this area that can actually cure acid reflux. Let's talk about this. Dr. Anciano, you didn't discover this procedure.
No, we didn't.
But you two are the first to do it in this area.
Correct. And we were part during our training years ago, we were part of the pilot studies when this was being looked at as a possibility, and they all panned extremely well. And now it's actually FDA approved and indicated for acid reflux, hiatal hernias, non-hiatal hernias, for all this work.
Dr. Spiker, it's called LINX, L-I-N-X. How does it work?
So this is basically, and we brought one here for you.
Yeah, they actually brought one here. I don't know, for the TV audience, it looks like a little, what does it look like?
Yeah,
I don't know.
Basically it's
It's
a
a
band
little
of,
chain.
it's a chain of magnetic beads that we place circumferentially around the esophagus, down near where the esophagus and stomach connect. And there's a magnetic attraction between these beads so that the band can open and close. So it can open to allow your esophagus to push food through, but then it closes off and your stomach cannot push the reflux back up into the esophagus.
So what kind of results are you getting from this?
They're extremely well. Our patients go home, unless they have a very big hiatal hernia that we repair to at the time, they tend to go home on that same day. They're off their antacid medications that same day. They take their last pill the day of the surgery. And they're extremely happy with it. There's a couple of weeks after surgery when they feel a little discomfort, and we walk them through it as your body gets used and scars down to having the device there, and then all that goes away. And
How long has this surgery been around?
we just started it around
we just
here. It
started
hasn't
this
been
spring.
here in the area. We
But
just started this spring.
Anywhere. Has it been being done in other places?
Yeah, it's been done in other places. It was finally approved about 10 years ago by FDA for trials and that, and now it's been close to 5-6 years. There's close to 9,000 of these walking around right now.
So, Dr. Spiker, we were just talking about this during the commercial. I take medication for acid reflux.
Yeah.
Why is this better than medication?
Well, recently there have been a lot of studies that have come out showing that there are some dangers with those medications. For a long time, we thought that they were very, very safe to take for long periods of time. Those medications are frequently taken by young people for years and years and years. We're finding out now that there can be issues with kidney problems, mineral deficiencies, and even recently some studies have shown links with Alzheimer's disease. So as time goes on, we seem to be finding more and more issues with these medications. We're recommending more and more, especially with young people, that they have this type of surgery to correct their reflux.
Dr. James Spiker, Dr. Carlos Anciano from the Brody School of Medicine here in Greenville, doing this revolutionary new surgery for acid reflux patients. Dr. Anciano, who is a candidate for this? Who should consider having this done?
Yeah, so many people, when you look at the studies, close to half of the population in the United States will have, at some point or another in their life, pretty bad acid reflux. And most of these people usually go over-the-counter medications. So first of all, we recommend anybody that's having a constant or recurrent issue with it to consult with a physician so they can rule out that there's no other issues going on. And then any patient that wants to get off the medications, that has a long life ahead of them. These are good medications, but they're not made to be taken forever. And so anybody that's looking at a long period of years ahead of them with this medication should be a candidate. People that the medications are not working anymore. People that have hiatal hernias. You don't need to have a hiatal hernia, but people that have hiatal hernias. People that regurgitate, which is a term for when you swallow food and the food comes back into your throat. See, these medications, they help you reduce the acidity of the reflux, of the volume that comes up and down in your esophagus. But they don't do anything about the volume itself that comes up and down. You just don't feel it because it's not burning. So people that have problems like cough, aspiration, hoarseness, people that can't eat and lean over and tie their shoes because food comes back into their mouth, any of those they're more than welcome to come and be evaluated for it.
Do you have to be referred by your family doctor, or can you just contact you directly?
A lot of that depends on your insurance. Some insurances require a referral from primary care physicians, some don't. So you can always contact our office, and we can give you the information as to whether or not you would need a referral from your primary care provider.
I'm looking at this thing, and again, they've just handed me one of these links. Is that what you call it?
Mm-hmm.
Is it called? Is that the brand, or is that the name of the device?
That's the name of the device. It's
So-
made by a company called Thorax Medical.
Okay, so this is a Lynx, and it almost looks like a little tiny child's bracelet, but is it metal?
It's titanium.
So are you going to set off metal detectors in in airports if you have this thing around your esophagus?
No, you don't
Because
set
it's
up the metal
titanium.
detector because it's titanium. Yeah.
Yeah,
You do have a certain degree of MRIs that you cannot have when you have the device. You can have some of them. There's cases where people are so happy with the device where you take them out, they get their MRIs, and then they want it placed back in.
Right.
So that's been
Right.
done. So yeah.
Well, I don't want to get too technical about how you do this because that's surgery and that's what you guys do. But it's round and it's connected. So how do you get it around the esophagus?
It comes unconnected, actually.
Okay,
So
and then you got to
when
reconnect it.
Yeah.
Kind of like putting your wife's bracelet on your
Pretty
wife's
much.
necklace on the back.
Yeah, it's got a little clasp.
But you do this laparoscopically, right? So I mean, there's no incision?
Yeah, there's about 3 or 4 small Band-Aid sized incisions, less than a centimeter, and we operate on a camera. It's through the belly. We don't go through your chest, even though sometimes
Okay.
the
Oh, I
hernias
see. Yeah.
are in your chest, and so it's very, very small incisions.
So how do you get this to go back together?
It's interesting.
You guys have got to know what you're doing, right? Once you get this around somebody's esophagus, how do you get it to go back together?
There's a little game to it when we put it in, and the magnet leans you in, but you have to know exactly how to orient it. And there's a clipping system where you can afterwards you take the cords out and it's there.
Yeah.
It's strong enough that it's not squishing your esophagus shut. It just gives back the natural tone that everybody's valve should have.
So once you have this done, no more Prilosec, huh?
Right there.
No more Acifex, which is what I take. No more of that stuff.
Correct.
Right. You don't ever have to take it again. No. Are there any long range? I guess it hadn't been around long enough to know, but I mean, the projection on this is that this would last for the rest of your life?
Yeah, that's correct.
Yeah.
Wow.
All the studies that we have for 6-7 years now have shown good outcomes for that length of time, with very few side effects and very few major complications.
And so, again, people take pills, but pills don't stop Acifex. They just treat it, right? I mean, this stops it.
Yeah, they get rid of the acid, but they don't get rid of the reflux.
Yeah.
So that stops the reflux.
Right. Wow. Really something. What kind of response have you had since you announced this here in Greenville?
It's been great. I mean, I gotta tell you, doctors to doctor, mouth to mouth referrals, it works. It's slow, but it slowly penetrates that there's a couple guys doing this around. But I gotta tell you, once this thing showed up in Facebook, it just exploded. One of our patients put one of our patients
That's
put
amazing.
a note in, and then the ECU thing went in, and it just it just exploded in terms of people knowing and being aware that they have an option. And we definitely feel that it's we don't know if it's the perfect solution, if there's such thing in medicine, but it's definitely a thought-wise step on the right direction.
How did you guys decide to do this? Why did you decide to do it? Because if no one else was offering it in the area, did it just make sense at this point to do it?
Yeah, basically. It was him that came up with it. He had been involved in some of the pilot studies with it back in Pittsburgh, and I had heard some things about it, and we just kind of looked into it and thought that there was good data on it, and talked with the company and went and looked at some people doing it and looked at their results, and it just kind of went from there. Yeah.
So no more heartburn, no more regurgitation,
Correct.
no more bloating, and it just improves your quality of life. And It's who would have thunk it? Who comes up with these things?
Yeah, I wish we did. That's what I tell you.
Whoever did made a lot of money is going to continue to make a lot of money, I'm sure. All right. So how do people contact you? Again, you can ask your family doctor to refer you.
Yeah. And,
I guess. But if not, are you gentlemen easy to find at the School of Medicine?
Pretty much, I think.
Yeah, it's ECU Thoracic Surgery at the East Carolina Heart Institute.
Yeah.
If you just call there and ask for a referral to one of us, we can.
How many
Get
of
you
these
in.
are you doing now?
We're close to 1 or 2 a week.
Wow.
We use it a lot too on. There's other forms that were approached before for anti-reflux surgeries,
Right.
and they have high recurrence rates, and there were a lot in the area, and we're using it a lot on the redos for those failed ones, which and it has it has shown really good outcomes.
Well, if you don't want to take the medicine, and again, the medicine, I'm hearing it from my docs too. The medicines do have some side effects that over time, and I've been taking it for probably 10 years. And then, so I'm a candidate. So maybe I could. You ready? You ready to do it?
Yeah.
Can we do it right here, right now? How long does it take? Did you bring your
The
utensils?
team, we got the van out there.
I think we should do this, Michael, and you should go over and tape it. We could run it back on TV. What do you think?
Absolutely.
Well, you may see me soon. I'll tell you because it's something that so many people have problems with, and if this is the solution, this is quite a breakthrough. And now it's available right here in Greenville. Thanks to you both. It's great to meet you.
All right,
Pleasure.
thank you.
Thanks for having us.
Appreciate your being with us. And again, is there a website to learn more? I know you said Facebook, but how do we? Where do people learn more about this on the web?
So we have a couple of the videos up on our website on the Heart Center on the ECHI at ECU, and they have the links there, and you can go on Links for Life website as well, and we'll have a lot of information on the acid reflux and some nice videos and stuff.
Great. All right, Dr. Carlos Anciano and Dr. James Spiker from the ECU School of Medicine doing this surgery at Vidant Medical Center as we speak. You guys got one today?
Yeah.
You do have one today?
I have a clinic today. There's like 4 people
Thank
coming.
you both for coming by. It's a pleasure to meet you.
Thank you.